Have you ever noticed your legs feeling unusually heavy or tired, especially at the end of the day? Or maybe your feet swell, your calves ache, or there's a strange, nagging discomfort when you're sitting or lying down. These small, often overlooked signs may seem harmless at first. Many people brush them off as normal signs of aging, temporary fatigue, or the result of standing or walking too much. But what if these symptoms are your body's early warnings of a deeper, more serious issue silently developing beneath the surface? As we grow older, our bodies go through countless changes. Some are expected, others more subtle and hidden. Circulation slows, blood vessels lose their elasticity, and small imbalances in the body systems begin to show in unexpected ways. Unfortunately, the signs of poor blood flow in the legs often appear gradually, and because they don't cause immediate pain or disability, they're easy to ignore. This is where the real danger lies. What may begin as occasional swelling or tingling can quickly evolve into chronic venous insufficiency, varicose veins, or even more severe conditions like blood clots and leg ulcers. For older adults in particular, understanding these early signals is critical. Ignoring them can lead to long-term consequences, reduced mobility, ongoing pain, and in some cases, life-threatening complications. But here's the good news. Early detection can make all the difference. By paying attention to what your body is trying to tell you and seeking help at the right time, you can prevent these problems before they take hold. This video is designed to shed light on the subtle but important symptoms of poor leg circulation. We'll explore the signs that often go unnoticed, explain what they might mean, and provide tips on what to do if you experience them. Whether you're experiencing these symptoms yourself or caring for an older loved one, this information could be the key to avoiding more serious health issues down the road. Health isn't just about treating illness. It's about noticing the small changes before they become big problems. So, if you've ever felt that something just doesn't feel right with your legs, don't ignore it. Take a few minutes to watch this video. You may find answers you didn't even know you were looking for. And most importantly, you'll learn how to take care of your legs, your health, and your future, starting today. Symptom 1. Swelling in the legs, especially around the ankles and feet. Swelling in the legs, particularly around the ankles and feet, is not merely a cosmetic issue or a result of fatigue after a long day. It can be a silent but powerful warning sign that your blood circulation is compromised. Many older adults tend to overlook this symptom, thinking it's just part of aging or due to standing too long. But when swelling becomes persistent or worsens over time, it may signal a deeper problem: poor blood circulation in the lower limbs. This kind of swelling, known medically as edema, happens when blood isn't flowing efficiently back to the heart. Instead of moving upward through the veins, the blood pools in the lower extremities, causing fluid to leak into the surrounding tissues. The result is puffiness, tightness, and a feeling of heaviness that can gradually interfere with everyday movement and comfort. In its early stages, this swelling may appear mild and go away overnight or with rest, leading many people to ignore it. However, as circulation problems persist, the swelling can become chronic. Shoes may begin to feel tight, and it may become difficult to bend the ankles or move the toes freely. In some cases, the skin may even become stretched, shiny, or sensitive to the touch. The pressure from the excess fluid can make the legs feel achy or sore, especially after sitting or standing for long periods. Over time, chronic swelling can damage the skin and underlying tissues, leading to skin breakdown, sores, and an increased risk of infections. For people with poor circulation, this swelling is not just a symptom, it is a red flag. It often signals that the veins in the legs are not functioning properly. Conditions like chronic venous insufficiency, varicose veins, or more serious disorders such as deep vein thrombosis, DVT, and peripheral artery disease, PAD, may be behind the problem. In older adults or those with diabetes, obesity, or a sedentary lifestyle, the risk is even higher. These underlying conditions can significantly impair blood flow and make it harder for the body to remove waste and deliver oxygen to tissues. Ignoring this kind of swelling can lead to complications like leg ulcers, skin infections, cellulitis, or even blood clots that may travel to the lungs, causing a life-threatening pulmonary embolism. It's important to take action at the first signs of unusual or persistent swelling. Simple changes such as elevating the legs, wearing compression socks, and avoiding long periods of sitting or standing can provide temporary relief. However, these measures should not replace a medical evaluation. A healthcare provider can perform tests to check circulation, evaluate the health of your veins and arteries, and recommend appropriate treatment. Early diagnosis and intervention can help prevent more serious problems down the line. In some cases, medication, lifestyle changes, or even minor surgical procedures may be needed to restore proper circulation and reduce the risk of complications. For older individuals, especially those with other chronic conditions, awareness of leg swelling is crucial. It's not just a matter of comfort, it can be a sign that your body is struggling to maintain healthy blood flow. The earlier the issue is addressed, the better the chances of avoiding irreversible damage. Don't wait until the swelling becomes painful or disabling. Treat it as a warning signal and take steps to protect your vascular health. Your legs may be trying to tell you something, don't ignore the message. Symptom 2. Cold or numb feet and toes. Cold or numb feet and toes may seem like a minor inconvenience at first, something that happens when the weather is chilly or when you've been sitting still for too long. But for many older adults, this seemingly harmless sensation can be a serious warning sign of poor blood circulation in the legs. The human body relies on a healthy circulatory system to deliver warm, oxygen-rich blood to every part of the body. When circulation is impaired, the blood struggles to reach the extremities, especially the feet and toes. As a result, these areas may feel unusually cold or numb, even when the rest of the body is warm. This isn't just uncomfortable, it's a red flag that something may be wrong with your vascular health. Unlike temporary numbness caused by sitting in one position for too long, the numbness or coldness associated with poor circulation tends to be persistent or recurring. You might notice that your feet feel like ice even under thick socks or blankets. Or you may lose the ability to feel textures or temperatures with your toes, making walking more difficult and increasing the risk of injury. This lack of sensation can be particularly dangerous for older adults, especially those with diabetes, as it makes it harder to notice small cuts, blisters, or injuries that can later become infected. Poor circulation to the feet and toes is often linked to peripheral artery disease, PAD, a condition where the arteries that carry blood to the legs become narrowed or blocked due to plaque buildup. When these arteries can't deliver enough blood, the feet begin to suffer from a lack of warmth, oxygen, and nutrients. Over time, this can cause the tissues in the feet to weaken, and in severe cases, it may lead to skin discoloration, ulcers, or even tissue death, gangrene. That's why cold or numb feet should never be ignored, especially when the symptom is chronic. It's also important to recognize that this symptom often develops gradually. People may adjust to the sensation or assume it's just part of getting older. But the truth is that healthy aging does not include losing circulation to your feet. In fact, catching this symptom early can be the key to preventing more serious complications. If left unchecked, reduced blood flow can lead to infections, poor wound healing, and, in extreme cases, the risk of amputation. That's why medical attention is crucial when symptoms like this appear. There are several steps that can help manage cold or numb feet due to poor circulation. Regular physical activity, even gentle walking, can help stimulate blood flow. Avoiding smoking, eating a heart-healthy diet, and maintaining a healthy weight are also critical to improving circulation. In some cases, a doctor may prescribe medication to help keep the arteries open or recommend tests such as a Doppler ultrasound to assess blood flow in the legs. Compression socks may also help in mild cases, but they must be used under professional guidance, especially if arterial issues are involved. Ultimately, cold or numb feet are more than a comfort issue. They're your body's quiet way of saying, something isn't right. Older adults should never brush off this symptom or try to self-treat without understanding the cause. If you or someone you know regularly experiences coldness or numbness in the feet and toes, don't ignore it, seek medical advice. Acting early can make all the difference in preserving not just the health of your feet, but your overall quality of life. Symptom 3. Swelling in the lower legs, ankles, or feet. Swelling in the lower legs, ankles, or feet, also known as peripheral edema, is a common symptom that many people, especially older adults, tend to overlook. It's easy to dismiss this swelling as a result of long hours of standing, aging joints, or even the day's heat. But if the swelling is persistent, frequent, or getting worse over time, it could be a clear indication of poor blood circulation in the legs. Swelling in these areas often occurs because the circulatory system is not functioning efficiently, leading to a buildup of fluid in the tissues, particularly in the lower extremities. Normally, blood flows smoothly through the arteries to deliver oxygen and nutrients and returns through the veins to the heart. But when circulation is compromised, whether due to weakened veins, clogged arteries, or heart-related issues, the blood begins to pool in the lower parts of the body. Gravity makes this worse, especially when you're sitting or standing still for long periods. The pressure causes fluid to leak from the blood vessels into surrounding tissues, leading to noticeable puffiness and swelling. This can affect one or both legs and is often most pronounced at the end of the day. This kind of swelling may feel soft to the touch or may leave a dent when pressed, a sign known as pitting edema. It can make your shoes feel tighter, cause discomfort while walking, and even limit your mobility. More importantly, chronic leg swelling is not just a surface issue. It can be a symptom of serious underlying problems such as chronic venous insufficiency, heart failure, or kidney disease. All of these conditions interfere with the body's ability to circulate blood and remove excess fluids efficiently. Swelling can also increase the risk of skin infections like cellulitis, especially if you have diabetes or fragile skin. The stretched skin becomes more vulnerable to cracks and sores, which can let bacteria enter and cause infections. In more advanced cases, swelling due to poor circulation can lead to skin discoloration, thickening, or open ulcers that are difficult to heal. These complications can escalate quickly and may lead to long hospital stays or long-term damage if not addressed in time. What makes this symptom particularly concerning is how often it's normalized or ignored. Many older adults accept swelling as just part of getting older, unaware that it might signal a more serious cardiovascular issue. But the truth is, persistent swelling is never normal. It's your body's way of alerting you that something isn't functioning as it should. Ignoring the signs can delay diagnosis and treatment, allowing the underlying condition to worsen silently. Managing this symptom begins with understanding the cause. That's why it's crucial to consult a healthcare professional if you notice regular or unexplained swelling in your legs or feet. A doctor may recommend tests like venous Doppler ultrasound, blood work, or even a heart evaluation to determine what's behind the swelling. Treatment may include lifestyle changes like elevating the legs, staying physically active, wearing compression stockings, reducing salt intake, or taking medications to remove excess fluid from the body. In some cases, the swelling may improve with simple measures, but in others, it might be a red flag requiring more aggressive intervention. Either way, the key is not to wait. Don't let persistent swelling limit your quality of life or lead to more serious problems. Pay attention to your body, and if something doesn't feel right, trust your instincts and seek medical advice. The earlier you address circulation-related swelling, the better your chances are of maintaining your mobility, independence, and overall well-being. Symptom 4. Numbness or tingling sensation, pins and needles, in the legs or feet. Experiencing numbness or a tingling sensation, often described as pins and needles, in your legs or feet might seem like a minor annoyance at first. It can happen when you sit too long in one position or cross your legs for an extended period. But when this sensation occurs regularly, without an obvious reason, or lasts longer than a few minutes, it could be a warning sign of poor blood circulation in the lower extremities. This symptom should not be ignored, especially in older adults, as it may be an early indicator of a more serious issue with the vascular or nervous system. When blood flow is restricted, the nerves in your legs and feet may not receive enough oxygen and nutrients to function properly. This lack of nourishment can lead to the familiar pins and needles feeling, also called paresthesia. While it can come and go in short bursts, persistent or worsening tingling can signal that your body is struggling to circulate blood effectively. Poor circulation can stem from a variety of causes, such as peripheral artery disease, PAD, diabetes, nerve compression, or chronic venous insufficiency. One key concern is that this symptom often develops gradually. You might not notice it at first, or you may assume it's just due to tiredness or bad posture. But over time, as the underlying condition progresses, the tingling may become more frequent, more intense, or start to feel like burning or prickling in the feet or toes. It may even be accompanied by a loss of sensation, making it difficult to feel pressure, temperature, or pain. This is particularly dangerous for older adults, as it increases the risk of injuries and infections that go unnoticed. Numbness or tingling also interferes with balance and coordination. If you can't feel your feet properly, walking becomes more difficult and hazardous. Many falls among seniors can be traced back to sensory deficits in the feet. And because these sensations are often worse at night, they can also disrupt sleep, contributing to fatigue, irritability, and reduced overall health. Over time, if circulation continues to decline, the nerves can become permanently damaged, leading to neuropathy, which may be irreversible. This symptom becomes even more critical in individuals with diabetes, a condition that often affects both circulation and nerve health. In diabetic patients, numbness in the feet may be the first sign of diabetic neuropathy, a condition that can lead to foot ulcers, infections, and even amputation if not managed early. That's why it's essential not to dismiss tingling or numbness as harmless or temporary. Fortunately, early intervention can make a significant difference. If you notice these sensations in your legs or feet frequently, it's time to speak with your doctor. A thorough evaluation may include blood tests, a nerve conduction study, vascular imaging, or a physical examination to check for diminished pulses or skin changes. Identifying the root cause allows for appropriate treatment, whether that involves improving circulation, managing blood sugar, reducing inflammation, or making lifestyle changes. Simple steps can help alleviate symptoms and protect your nerve and vascular health. These include quitting smoking, exercising regularly, eating a balanced diet, controlling blood pressure and cholesterol, and maintaining a healthy weight. In some cases, doctors may recommend medications, physical therapy, or compression therapy to restore proper circulation and reduce nerve irritation. The bottom line is this: tingling or numbness in your legs and feet is your body's way of sending a message. Don't ignore it. Addressing it early can help you avoid more serious complications and maintain your independence and quality of life. As we age, being proactive about circulation and nerve health is one of the smartest things we can do. Symptom 5. Cold feet or legs, even when the rest of the body feels warm. If you often notice that your feet or lower legs feel cold to the touch, even when the rest of your body is warm and the surrounding environment isn't particularly chilly, this could be more than just a minor discomfort. Coldness in the extremities, especially in the feet or lower legs, is a common and early warning sign of poor blood circulation. It may feel like your feet are constantly cold, even under blankets, socks, or layers of clothing, and this can be particularly noticeable at night or during periods of rest. The reason behind this symptom is straightforward. When blood isn't flowing efficiently to the lower parts of your body, especially your legs and feet, these areas receive less warmth. Blood carries not only oxygen and nutrients, but also heat from your core. If circulation is compromised, your body will prioritize sending warm, oxygen-rich blood to vital organs like the heart, brain, and lungs. As a result, areas farther from the center of your body, like the toes, suffer from reduced blood flow and become colder. This condition can be caused by narrowed or blocked arteries, often due to peripheral artery disease, PAD. PAD is a common vascular condition, especially in older adults, and it develops when fatty deposits, plaque, build up inside the arteries, restricting blood flow. Other contributing factors may include diabetes, Raynaud's disease, anemia, or hypothyroidism. Regardless of the cause, cold feet should not be brushed off, particularly if it becomes a frequent occurrence. It's also worth noting that cold feet are sometimes accompanied by other symptoms like numbness, tingling, discoloration, or hair loss on the legs, all of which point toward a circulation issue. In some cases, the skin on your feet may look pale, bluish, or even shiny. The toenails may become brittle or slow to grow, and wounds on the feet or legs may take longer to heal due to inadequate blood supply. Beyond physical discomfort, chronically cold feet can affect your daily routine and overall well-being. You may find it difficult to sleep at night or need to wear multiple pairs of socks just to feel comfortable. For seniors, this is more than an inconvenience. It can impact mobility, increase the risk of slipping or falling, and reduce confidence in walking or exercising. Over time, poor circulation can weaken the tissues and nerves in your feet, increasing the risk of complications like ulcers, infections, or even tissue damage in severe cases. So what can you do if you're experiencing this symptom? First and foremost, talk to your doctor. A proper evaluation will help identify the cause of your cold feet and determine whether your circulation is being impaired. Diagnostic tests may include checking for a weak pulse in your legs, measuring blood pressure in different limbs, or using imaging studies like a Doppler ultrasound. In the meantime, there are several steps you can take to support healthier circulation. Stay active. Regular movement helps improve blood flow. Even simple activities like walking or gentle stretching make a big difference. Avoid sitting or standing in one position for too long, and try elevating your feet periodically to promote blood return. Wearing warm, breathable socks, keeping your home comfortably heated, and avoiding tobacco and excess caffeine are also important lifestyle changes. Diet also plays a role. Eating foods rich in omega-3 fatty acids, antioxidants, and vitamins like B12, and he can help support your blood vessels and improve circulation. If you have an underlying condition like diabetes or thyroid issues, managing those with proper medication and monitoring is essential. In short, cold feet are not just about the weather. They can be your body's way of telling you something deeper is going on. Paying attention to this subtle but important symptom can lead to early diagnosis and prevention of more serious problems. Don't ignore it. Taking action now could protect your mobility, independence, and overall quality of life. Symptom 6. Skin discoloration or slow-healing wounds on the legs and feet. One of the more visible and concerning signs of poor circulation in the legs is skin discoloration or the presence of slow-healing wounds, especially around the feet, ankles, and lower legs. While it may seem like a small patch of dry skin or a bruise that's taking longer than usual to fade, these outward changes often reflect a much deeper issue: insufficient blood flow, which affects your body's ability to nourish, heal, and protect your skin. When blood doesn't circulate properly, your tissues, particularly those farthest from the heart, like your feet and toes, don't receive enough oxygen and nutrients. This weakens the skin and underlying tissue, making it more prone to injury, infection, and breakdown. Minor cuts, scrapes, or pressure points from shoes can turn into open sores, ulcers, or wounds that resist healing. What might be a simple scratch for someone with good circulation can linger for weeks or even months in someone with compromised blood flow. In addition to wounds that don't heal, you may notice unusual discoloration of the skin. This can appear as dark purple or reddish spots, bluish toes, or skin that looks shiny, tight, or stretched. In some cases, the skin may become pale or take on a yellowish tone. These changes indicate that the blood vessels in the area are struggling to deliver and remove what your body needs to stay healthy. One condition that often goes hand in hand with this symptom is peripheral artery disease, PAD, where narrowed arteries reduce blood flow to the limbs. In more advanced stages of PAD, even slight trauma to the skin, like bumping your leg on a chair or wearing tight socks, can result in damage that's hard to reverse. Another related issue is chronic venous insufficiency, which affects how well blood returns from the legs to the heart. This can cause swelling, brownish skin staining, or thickened patches around the ankles. The risk of infection also rises when circulation is poor. Your immune cells, which travel through your bloodstream, have a harder time reaching the wound site. This makes it easier for bacteria to invade and harder for your body to defend itself. For people with diabetes, this issue is especially dangerous, as they may not feel pain due to nerve damage, meaning they might not even notice a wound until it becomes serious. Over time, if left untreated, chronic wounds can lead to severe complications such as cellulitis, gangrene, or in worst-case scenarios, amputation. That's why recognizing and addressing this symptom early is so important, especially for older adults whose bodies may already be healing more slowly due to age-related changes. If you notice a wound on your foot or leg that isn't healing, or if you see discoloration that doesn't go away, don't wait. Consult your doctor immediately. They may perform tests like the ankle brachial index, Doppler ultrasound, or other imaging to assess how well blood is flowing through your legs. Based on the diagnosis, they might recommend lifestyle changes, medications to improve circulation, or even surgical options to restore proper blood flow. In the meantime, take proactive steps to protect your skin and promote circulation. Inspect your feet and legs daily, especially if you have diabetes or a history of vascular issues. Keep your skin clean and moisturized. Wear well-fitting shoes and socks, and avoid standing or sitting too long without moving. Elevating your legs, staying hydrated, and engaging in gentle physical activity like walking can also help blood flow more freely. In conclusion, slow-healing wounds and changes in skin color are not just skin-deep issues. They are serious signals from your body. By paying attention to these signs and taking action early, you can prevent complications, protect your health, and maintain your independence for years to come. As we age, our bodies begin to send out silent signals about our health. Heavy legs at the end of the day, swollen feet, numbness, or a dull ache in the calves. Many people think it's just fatigue or aging. But in fact, it could be an early warning sign from the body about poor circulation, a problem that should not be ignored. Blood circulation is vital for nourishing cells and maintaining organ function. When blood doesn't circulate well in the legs, it not only causes discomfort, but can also lead to complications such as varicose veins, blood clots, or even leg ulcers. These seemingly small things, sometimes just a slight swelling, a tingling sensation, if ignored, can become serious problems that affect the quality of life. The important lesson here is listen to your body, especially your legs. Watching for unusual signs and taking proactive care will help prevent future complications. Nothing too complicated. Make it a habit to walk lightly every day, elevate your feet when resting, and avoid standing or sitting in one place for too long. If possible, gently massage or use medical socks to support blood circulation. And especially, don't hesitate to see a doctor when your body speaks. Health is not just about medicine or hospitals. Sometimes, the smallest attention brings the biggest changes. Old age is not a time to weaken, but a time to slow down. Take better care of yourself and appreciate every steady step. Starting today, pay attention to your feet because they not only support your body, but also reflect your overall health. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.